Yeah, so what we get to do on Friday nights is really exciting, especially as a former athlete. I mean, it brings back a lot of memories. The reason I got interested in orthopedics and sports medicine to begin with was because of an injury myself. And I remember still to this day just being devastated when the injury occurred, just thinking, am I going to be okay? Am I going to get to play again? This is something that I've worked so hard for. And then being able to come back from that just really gave me the drive and desire to be able to do that for others, as I became an orthopedic sports medicine physician. At Gulf Orthopedics, we're a really diverse team of orthopedic sports medicine physicians. It really allows us to bring a lot of different ideas to the table when we're working and dealing with athletes. We bring a lot of different perspectives on how to treat certain injuries and a lot of different techniques that we may have learned along the way. So if I have a difficult case, I can go to one of my partners and run that by them. And I'm not just talking into an echo chamber. I'm going to get varying different opinions about how that injury should be treated. Having those different backgrounds and experiences in our training really helps us to provide the best care to athletes that we can. And sports medicine is not just all about an athlete who's playing on a team, right? I mean, as we get older, I know personally as I get older, you continue to look for ways to be active and be involved in in different athletic pursuits. And we see a lot of patients who are wanting those same things, especially patients who are getting into their 40s, 50s, 60s, and even older, trying out new things as they get older. And these are not going to look like your traditional athletes. Sometimes these are just your 5K runner on the weekends. Sometimes these people are out doing obstacle course races. Sometimes these people are out kite surfing. And that's a really exciting area for me as I continue in my career, as I look at my patients and also as I look at just myself as an athlete as I get older as well, as hey, okay, what are the things that we can do to treat injuries as they happen, but also to keep our bodies strong, healthy, fit, so that we can continue to pursue these goals no matter what our age is. We are so lucky to get to do what we do. We get to become part of a team, and man, these schools and parents and administrators and coaches, I mean, they're really gracious in how they let us become part of their program, to be there for athletes when they get hurt on the field, and to provide a really prompt evaluation to make sure that athlete's okay to go back in the game or whether they need to come out, or and hopefully help that athlete get back to play as quick as they can, and certainly to prevent further injuries. And I think about that on Friday nights. It's not just another injury. I mean, this is a kid who's, they've worked hard. This is their passion. They have goals. They want to keep playing this sport. And they have all those questions going through their mind. And I remember that, and I really try to let that really color the way that I treat them.